Well, Madison County leaders say we're doing a good job adjusting to all these changes, but we still have a long road ahead, and some new measures could be on the way. Our Sydney Stallworth gives us an update.
The good news today is not much has changed since I talked to you on Monday.
Officials say COVID-19 numbers are staying fairly consistent in Madison County, but there are new changes in the works. Huntsville Hospital System is asking for those with medical experience to reach out and provide their information in the event of a major surge.
We know there are people because we're getting phone calls from people who have said, hey, if you need help, I'm out here. We're going to start formally tracking that.
They'll keep a database of locals in case hospitals are over capacity and understaffed. A surge in numbers has been expected, and steps are being taken to make sure everyone in our community can have access to testing.
Go out and try to start testing our homeless community. We've got a coordinated effort going on to do that.
That testing is expected to start later on this week. Mayor Paul Finley says the Madison COVID-19 numbers are lower than anticipated.
Even a week ago, and I wrote down a couple of numbers, they projected up to 8,000 deaths. They're now projecting that number down to 634.
There are concerns that the virus impacts people differently depending on race, health history, and more.
We don't have a large enough sample in our group in the number we tested, I think, to be statistically significant.
But David Spillers does say certain conditions can put you at a higher risk for complication.
A vast majority of those people have some other conditions, and it could be everything from obesity to COPD, heart disease, diabetes, the whole list.
And COVID-19 can be deceiving.
I think that's just one of the scary things about this disease is it will get people that are absolutely look healthy in every other way.
Putting the Valley first, Sydney Stallworth, WZDX News.